What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my anatomy playlist. In previous videos, we talked about the aorta, we talked about the common carotid artery, the internal carotid artery, and the external carotid artery. And I have discussed the chemoreceptors and the baroreceptors in my physiology playlist. The last video was on the subclavian artery and its 3 different parts. Remember that the vertebral artery is a branch of the first part of the subclavian artery. That was the last video. Today we shall talk about the superior thyroid artery and the inferior thyroid artery and their different origins. These thyroid arteries not only supply your thyroid gland, but they also supply your larynx, which is your voice box that helps you talk too much. Click the like button, click the subscribe button before I massage both of your carotids simultaneously. I will never do this to you because I love you. You should never massage both carotid arteries at the same time. Otherwise, you will trigger a severe baroreceptor response, because when you massage both of the carotids at the same time, the body understands this as extremely high blood pressure, severe hypertension. So the body responds by doing the opposite, by lowering your heart rate big time, so you suffer from reflex bradycardia, and by dilating your vessels big time in order to lower the blood pressure. But when you massage both of the carotids at the same time, this can go too far, causing severe hypotension and bradycardia, which can cause fainting and could be fatal. Don't forget to watch my video on the carotids. And if you wish to see more videos like this in the future, drop a brain emoji in the comments. And my video on the subclavian before this one. You can find these in my anatomy playlist. Let's use the Socratic method, questions and answers. Question: can you pause the video and label all of these structures? Let me know your answer in the comments. Are you ready for the answers? Let's go. This is the left atrium or the left auricle. This is the right atrium. This is the left ventricle. This is the right ventricle. The left ventricle ejects oxygenated blood into the aorta, E, whereas the right ventricle ejects deoxygenated blood into the pulmonary trunk, which will then branch into the right pulmonary artery and left pulmonary artery. The aortic arch has 3 main branches: brachiocephalic trunk, left common carotid artery, and left subclavian artery. In some people, there is a 4th branch coming out of the aortic arch. What is that 4th branch? If you know, comment below. This is the right atrium. It receives venous blood from 3 sites. 1, from the superior vena cava, which drains the upper half of your body. 2, the inferior vena cava, which drains the lower half of your body. And 3, from the coronary sinus, which drains the heart itself. The arteries that supply the heart are called coronary arteries, but the veins that drain the heart eventually become the coronary sinus, which drains into the right atrium. As you can see, this right atrium receives deoxygenated blood from all the main veins of the body, and that's why in physiology, the name of the pressure within the right atrium is the central venous pressure, i.e., you can think of the right atrium as the central vein of the body. And that is such an honor for a tiny chamber. We do this every time because repetition is the mother of pedagogy. The apex of the heart is formed by the left ventricle. The left ventricle has oxygenated blood. The left ventricle has a cavity and it has an outflow tract. The outflow tract is going to lead you to the aorta. Ascending aorta, aortic arch, descending thoracic aorta, pierce the diaphragm, or more accurately, pass behind the diaphragm at the level of T12 to enter into the abdomen and become the abdominal aorta by a verbal sleight of hand. The ascending aorta has a sinus, and this sinus will give me right coronary artery and left coronary artery. That's the ascending aorta. Then the aortic arch will give me brachiocephalic artery, left common carotid artery, left subclavian artery. Left ventricle again ejects oxygenated blood into the aorta. This is the ascending aorta. This is the aortic arch. This is the descending thoracic aorta. The ascending aorta has a sinus, which gives us the right coronary artery and the left coronary artery. The aortic arch has 3 main branches: brachiocephalic trunk, left common carotid artery, and left subclavian artery. Now I can see that I have a subclavian artery on the left, but where does the subclavian artery on the right come from? There you go. This is the ascending aorta, right coronary artery and left coronary artery. The left coronary artery will then divide into left anterior descending and left circumflex. But I digress. Back to the aortic arch. It has the brachiocephalic artery, it has the left common carotid and the left subclavian. The brachiocephalic artery itself will divide into right subclavian and right common carotid. This is the right vagus nerve. This is the left vagus nerve. The right vagus nerve, which is cranial nerve number 10, after descending that much, it forgot something. Oh, I forgot to give the recurrent laryngeal nerve. So we'll give the recurrent laryngeal nerve, which will loop around and below the right subclavian on the right side. But the left vagus is different. It also forgot the recurrent laryngeal, and then it remembered to give the recurrent laryngeal that will arch below the aortic arch, just near the ligamentum arteriosum, formerly ductus arteriosus. A ductus arteriosus is a duct between two arteries, the aorta and the pulmonary trunk. And the answer is the right subclavian artery is a branch of the brachiocephalic trunk, because the brachiocephalic trunk, which is the first branch of the aortic arch, is going to divide into a right subclavian artery for your arm and a right common carotid artery for your head. This is the left common carotid artery and this is the left subclavian artery. What's the name of this doozy nerve? If you know, comment below. How about that dorky nerve, which is a breath of fresh air, no pun intended? What's the name of that nerve? Comment below. Today's video is just a sample of the longer review on the anatomy of the head and my other videos on the anatomy of the neck review. You can find all of my review videos in a glorious playlist titled A 90 Minutes Quick Review, where you will find review videos for the anatomy of the head, review videos for the anatomy of the neck, review videos for the anatomy of the thorax, the abdomen, the pelvis and perineum, upper extremities, lower extremities, embryology, and neuroanatomy. Each one of these regions is reviewed in 3 videos. Part 1 is titled Quick Review, Part 2 is Ultimate Review, and Part 3 is Clinically Oriented Anatomy of that region. So there is Quick Review for the anatomy of the thorax, Ultimate Review of the anatomy of the thorax, and Clinically Oriented Anatomy of the thorax. If you can just watch these videos, you will know more anatomy than the vast majority of people who live on this planet. But wait, there is more. I have review videos for physiology, review videos for biochemistry, for molecular biology, genetics, pharmacology, pathology. And I cannot forget microbiology. There is a review video for general micro on the gram-positive bacteria, the gram-negative bacteria, the viruses, the fungi, and human parasitology. And I have review videos for internal medicine, 2 review videos for cardiology, 2 on neurology, 2 on pulmonology, endocrinology, hematology, oncology, immunology, rheumatology, nephrology, GI, dermatology, ophthalmology, ENT, infectious diseases, geriatrics, and EKG. And a review video for emergency medicine. If you want me to make review videos on these topics, please let me know in the comments. You'll find several review videos for surgery, as well as pediatrics and obstetrics and gynecology. All of them are in my playlist titled In 90 Minutes Quick Review. And back to the video. Here's the aortic arch, brachiocephalic artery, left common carotid, left subclavian. Brachiocephalic will then give me right subclavian and right common carotid. Right common carotid will become external carotid and internal carotid. That's on the right side. On the left side, the left common carotid will also divide into left internal carotid and left external carotid. The internal carotids are for the brain, the external carotids are for the face, basically. At the bifurcation of the common carotid into external and internal, we see the carotid sinus. Carotid sinus contains baroreceptors. The carotid body contains chemoreceptors. Both the baroreceptors and the chemoreceptors in the carotid sinus are supplied by the glossopharyngeal nerve, which is the 9th cranial nerve. However, the chemoreceptors and baroreceptors in the aortic arch are supplied by vagus, because the vagus nerve comes close to the aortic arch before it remembers to give its recurrent laryngeal nerve. The brachiocephalic artery will then give me right subclavian and right common carotid. The common carotid will give me external carotid and internal carotid. The left common carotid will also give me internal and external carotids. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. All of this fancy schmancy area is your neck. This bone above is the mandible. This is the base of the skull, particularly the basilar part of the occipital bone. This is the sternum, or the manubrium sterni, and this is the clavicle, this is the scapula. What was the name of the cranial nerve that emerged between the styloid process and the mastoid process? You can learn more about the anatomy of the head and neck here. Here is an outline of all of the topics covered in my review videos on the anatomy of the head and on the anatomy of the neck. Today we'll talk about the superior thyroid artery and the inferior thyroid artery. To learn about the subclavian, watch the previous video. To learn about the carotids, watch the video before that. All of them are in my anatomy playlist. The neck is made of a bunch of cervical vertebrae, as we have discussed in the previous video. What's unique about the cervical vertebrae is that they have foramen transversarium, or a foramen inside the transverse process. This is the transverse process of the cervical vertebra. It has an anterior tubercle and a posterior tubercle and a foramen transversarium through which the vertebral artery passes. This is true for C1, C2, C3, C4, C5, and C6. All of them form a canal, so to speak, for the vertebral artery. But C7 is different. C7 has a foramen transversarium, but it's for accessory vertebral vein and not a vertebral artery. And we talked about that in the previous video. This is the trapezius. This is the midline of the neck. This is the sternocleidomastoid. Behind the sternocleidomastoid, there's the posterior triangle. In front of it, there's the anterior triangle of the neck. This is the omohyoid muscle, from the scapula to the hyoid bone. It has a dirty intermediate tendon that attaches to the clavicle by a double sling. Connective tissue wraps around connective tissue, back to the clavicle. This is the brachiocephalic artery. This is right subclavian. This is right common carotid. The right common carotid will give me right internal carotid for the brain and right external carotid for the face. The internal carotid has 5 branches. The 2 most important ones are anterior cerebral and middle cerebral. The external carotid artery has 8 branches. I just want you to remember 2 for now. 1 internal, 1 external. The internal one is the deeper one. That's the maxillary artery. The more superficial one is the facial artery. This is the facial artery. From the subclavian artery, we see this vertebral artery. You see it passes through the foramina transversarium of C6, C5, C4, C3, C2, and C1. But it does not pass through C7's transverse foramen. The anterior circulation of the brain is supplied by the internal carotid, whereas the posterior circulation of the brain is supplied by the vertebral artery. 2 vertebral arteries join forces to give me this basilar artery. The basilar artery has many branches. The final ones are posterior cerebral arteries. So now we know where the anterior cerebral, middle cerebral, and posterior cerebral came from. ACA and MCA from the internal carotid, PCA from the basilar, which came from the vertebral. Why do we call the basilar artery basilar? Because it runs on the basis pontis, or the base of the pons. Also because it's located at the base of the brain. This is the brachiocephalic trunk, this is right common carotid, and this is right subclavian. The subclavian artery has 3 parts. First part, or S1, second part, or S2, third part, or S3. The first part is medial to the scalenus anterior muscle. The second part runs behind or deep to the scalenus anterior muscle. The third part is lateral to the anterior scalene muscle. And now to the most important part of the video. This is the right subclavian artery. It has 3 parts. First part, second part, and third part. First part is medial to scalenus anterior. Second part is behind scalenus anterior muscle. The second part is accompanied by the brachial plexus. Third part lies lateral to scalenus anterior muscle. The first part of subclavian artery has 3 branches. The second part has 1 branch. The third part has no branches in most people. What are the 3 branches of the first part of subclavian? Number 1, vertebral artery runs up until it enters the foramen magnum of the skull. It runs through the foramina transversaria of all of your cervical vertebrae except C7. Vertebral artery provides the blood supply to the back of the brain. It's the posterior circulation. Vertebral artery on the right and vertebral artery on the left shall unite in the midline to form the basilar artery, which runs anterior to basis pontis of the pons. The second branch of the first part of subclavian artery is this, internal thoracic artery, otherwise known as internal mammary artery, which will end up by giving us two terminal branches, which are superior epigastric artery and musculophrenic artery. The third branch of the first part of subclavian is the thyrocervical trunk, which is a very short trunk, which will immediately end by giving us three terminal branches. Inferior thyroid artery for the thyroid and the larynx, suprascapular artery above your scapula, and transverse cervical artery, which will divide into superficial and deep branches. Then, the second part of subclavian artery gives us one branch, which is costocervical trunk. Please do not confuse thyrocervical trunk, which is a branch of the first part, with costocervical trunk, which is a branch of the second part. The costocervical trunk, costo means ribs, cervical means neck, will run close to the pleura at the apex of the lung, and then will give us deep cervical artery and superior intercostal artery. The superior intercostal artery will give us the first and the second posterior intercostal arteries. To learn about the posterior intercostal arteries and the anterior intercostal arteries, please refer to my videos on the thorax. Look at this wonderful picture. Look at it and respect it. Medicosis is putting Frank Netter to shame. Here's a question for the pros. One of the terminal branches of the internal thoracic artery is the superior epigastric artery. This superior epigastric artery from above is going to anastomose with the inferior epigastric artery coming from below, and they meet one another right around the umbilicus, or at the level of the umbilicus. My question is, where did the inferior epigastric artery come from? You know that the superior epigastric one came from the internal thoracic artery, but where does the inferior epigastric artery come from? If you know, comment below. This is brachiocephalic artery, this is right subclavian, this is right common carotid. Notice that the right subclavian has three parts. The first part is medial to scalenus anterior, the second part is behind scalenus anterior, and it's accompanied by the brachial plexus. The third part of subclavian artery is lateral to the scalenus anterior muscle. The first part of subclavian has three branches, the vertebral artery, which runs up until it enters the cranial cavity, the thyrocervical trunk, and the internal thoracic artery. The thyrocervical trunk will give us inferior thyroid artery, suprascapular artery, and transverse cervical artery. Back to the common carotid artery, it will give us two terminal branches, external carotid artery for the face and internal carotid artery for the brain. Here's the first part of subclavian artery. This is the vertebral artery. It runs through the transverse foramina of C1, C2, C3, C4, C5, C6, but not C7. It ends up by entering the foramen magnum, uniting with the vertebral artery on the other side to form the basilar artery, which runs anterior to basis pontis. The basilar artery ends up by giving us two posterior cerebral arteries. Back to the common carotid artery. This is brachiocephalic, this is subclavian, this is common carotid. Common carotid will give me internal carotid for the brain, which enters through the carotid canal. It bends forwards and up, disrespecting itself and disrespecting the cavernous sinus. But it gets disrespected by sympathetic nerves, piggybacking on this internal carotid artery until they give us the deep petrosal nerve. After that, these sympathetic fibers will piggyback onto ophthalmic artery, which is a branch of internal carotid, until they reach the eye. What are the 8 branches of the external carotid? Superior thyroid artery, lingual artery, facial artery. All of these are from the anterior aspect. From the posterior aspect, we have occipital artery and posterior auricular artery. From the medial aspect, or the inner aspect of the external carotid, we have the ascending pharyngeal artery for the pharynx. The 2 terminal branches of the external carotid are the maxillary artery and the superficial temporal artery. Don't forget that the superior thyroid artery is a branch of external carotid, whereas the inferior thyroid artery is a branch of the thyrocervical trunk, which is a branch of the first part of subclavian artery. This is the external carotid artery. This is superior thyroid artery. This is lingual artery, which is very tortuous because your tongue moves a lot because you talk too much. And this is facial artery. Also tortuous because you're gonna turn your head to the left, to the right, etc. These are the branches of the anterior aspect. Then we have occipital artery and posterior auricular artery from the posterior aspect of the external carotid. Not shown here is the ascending pharyngeal artery. The two terminal branches are the maxillary artery and the superficial temporal. This is external carotid artery. It has 8 branches. What are the two terminal branches? Maxillary artery and superficial temporal artery. One of the terminal branches of the external carotid artery is the maxillary artery, which has 3 different parts. Each part has about 5 branches. We'll talk about all of them in detail in my next video titled Maxillary Artery in this anatomy playlist. How about the ophthalmic artery? That's a branch of the internal carotid, not the external carotid. And I've talked about the ophthalmic artery in my video titled The Carotids. Arterial supply of the pharynx. First, ascending pharyngeal artery. Where did that come from? This is one of the branches of the external carotid artery. Second, tonsillar artery. Where did that come from? From the facial artery of the external carotid artery. Third, ascending palatine artery. Also a branch of facial, which is a branch of the external carotid artery. Fourth, superior thyroid artery, which is a direct branch of external carotid artery. And inferior thyroid artery, which is not a branch of the external carotid, but instead, the inferior thyroid came from the thyrocervical trunk, which came from the first part of subclavian artery. So, superior thyroid is not the same as inferior thyroid. Superior thyroid is a direct branch of external carotid artery, whereas inferior thyroid artery is a branch of the thyrocervical trunk, which is a branch of subclavian. Here is your daily reminder that the external carotid artery has 8 branches. It gives us superior thyroid, lingual, and facial arteries from its anterior aspect. It will give us occipital artery, posterior auricular artery, and ascending pharyngeal artery. And then it will give us its 2 terminal branches, maxillary artery and superficial temporal artery. The arteries that are going to supply the pharynx include, of course, the ascending pharyngeal artery, the facial artery, and the superior thyroid artery. The pharynx is supplied by ascending pharyngeal artery of the external carotid, tonsillar and ascending palatine of the facial of the external carotid, superior thyroid from the external carotid, and inferior thyroid from thyrocervical trunk of subclavian. That was the story of the pharynx, but how about the larynx? The larynx was supplied by superior laryngeal artery, which is a branch of superior thyroid, and inferior laryngeal, which is a branch of inferior thyroid artery. This is superior thyroid artery. As you see, it's a branch of the external carotid. This is external carotid, this is internal carotid with the famous carotid sinus, and this is the common carotid artery. This is superior thyroid artery. How about the inferior thyroid artery? This is the inferior thyroid artery, which is a branch of the thyrocervical trunk, which is a branch of the first part of the subclavian artery. That's amazing. These thyroid arteries not only supply the thyroid gland, but they supply the larynx as well, and part of the pharynx. Why should we care about these thyroid arteries too much as surgeons? Because they can get injured, especially during a surgery known as thyroidectomy, when you're trying to remove the thyroid gland. The topic of the complications of thyroidectomy was a big deal as far as the late famous singer Kulthum was concerned, because she wanted to undergo thyroid surgery, but she refused once she became aware of the complications of thyroidectomy. I've told her story in my video titled Clinically Oriented Anatomy of Endocrine Glands, which you can find in my endocrinology playlist. We'll see you later. Don't forget that superior thyroid artery is a branch of external carotid, whereas inferior thyroid artery is a branch of thyrocervical of subclavian. Pause and review. By now you should know everything about the foramina of the skull and the structures that pass through them. Don't forget that the carotid canal is for the internal carotid artery, the jugular foramen is for the internal jugular vein and other nerves, foramen magnum is for the 2 vertebral arteries, and the spinal arteries, 1 anterior and 2 posterior spinal arteries. The foramen spinosum is for the middle meningeal artery. Don't forget that the philosopher Baruch de Spinoza is an MMA fighter. MMA fighter, middle laryngeal artery, is foramen spinosum. The optic canal contains the ophthalmic artery, which is a branch of the internal carotid artery. That's it for the arteries of the neck. But how about the veins of the neck? They will be discussed in a separate video titled The Neck Veins in my anatomy playlist. Or you can simply go to my video on the anatomy of the neck ultimate review to learn about all of these subjects. Before you leave this video, I want you to sit down, focus, and try to answer the following questions. Where can I find each of these foramina on the skull? And what are the structures that pass through each one of these? Please pause and review. This is very important. Here is a subject that drives students crazy. Antibiotics pharmacology. You can download my antibiotics course at medicosisperfectionalis.com. It comes with videos, notes, and cases, and a mind map to help you memorize these antibiotics. It will teach you about antibacterials, antivirals, antifungals, and antiparasitic medications. Download it today. After mastering anatomy, you can master surgery by downloading my surgery high yields course at medicosisperfectionalis.com. I help you learn, understand, and pass exams. I have many courses on my website. Each one comes with videos, notes, and cases. If you find these videos to be helpful, please consider supporting my channel by buying me a coffee. Go to buymeacoffee.com/medicosis. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.